Hello and welcome. You're watching Yashoda Hospitals, the Health Talk session, where all your health related queries are answered here. I'm Dr. Lakshmi, and joining us today, we have with us Dr. Ronco from Italy and Dr. Rajasekhar Chakravarthi, Clinical Director and Head of the Department from Nephrology and Transplant Services from Yashoda Hospitals, High Tech City.
Ciao mondo, hello world, hola mundo, hello monde, namaste, ni hao.
We are here for another cappuccino with Rajasekhar Chakravarthi at the Yashoda Hospital in Hyderabad. And we have a special occasion today because we have the CRRT and AKI highlights from the San Diego meeting. That is a real, actually, AKI and CRRT meeting in Hyderabad with many friends from India attending. Today, even we had the presence of the governor of the state, Telangana. So I think we are really lucky, right?
Privileged.
So do you want to comment on the whole meeting, organization, the topic, etc.?
Yes. Thank you very much, Dr. Ronco. As Dr. Ronco told us, we are hosting the 7th annual AKI and CRRT meeting here at Yashoda High Tech City today. India is facing a huge burden of chronic kidney disease. But what we now know, which we did not know in yesteryears, is that 30% of CKD actually comes from acute kidney injury, which is the other spectrum of CKD. By learning to recognize AKI early, picking it up early, managing it well, we are actually reducing the burden of CKD in a country like India. So my thanks to Dr. Ronco for making this happen and for sharing the knowledge from his own experiments and the work that they have done in Italy with us.
So, you know, this actually is a continuum that will involve this meeting. Then in March we have the San Diego meeting, and then in June we will have the Vicenza course on AKI and CRRT. And across the world and continents, it is now clear that the AKI to CKD transition is becoming one of the very important aspects to be studied in order, first, to prevent AKI, second, to prevent all the factors that may be fibrogenic or angiogenic that may alter the structure of the kidney, leading to hyperfiltration, leading to progression of chronic kidney disease. Now, I have seen that you had an international faculty, but also you had a national faculty, and specifically in this hospital, you have a very, very nice competence and use of the most modern extracorporeal techniques. So, can you tell us a little bit about your hospital here?
Yeah. Yashoda Group is almost 35-year-old. Started off as a 50-bedded nursing home, but now they have 4 huge hospitals in 4 corners of the city of Hyderabad, together catering to around 4,000 hospital beds. And 30% of each of these hospitals, they have ICU beds. And these ICUs are medical, surgical. They also have cardiac ICUs and pediatric ICUs. It is one of the units in the country which does maximum number of transplants, liver, renal and pulmonary. Obviously, there is a lot of acute kidney injury work. The good thing is all the 4 units ICUs work as a single unit, and we are able to capture our data, and with help of Dr. Ronco and other faculty, we are able to share this information to improve our quality. So as Dr. Ronco and other faculty taught us, it is Q and Q, quantity, but the quality is more important so that the acute does not transition to chronic kidney disease.
And I think it's very important that we also matured a lot of human and personal relationship during this meeting. In particular, I met several intensivists and nephrologists that are willing to come and visit us in Vicenza, where we plan, hopefully, to do some interesting studies for the future which are collaborative. And the final topic is a sentence that the governor of Telangana said today: a smile of a patient is probably the smile of the world. So we have to take care of human aspects. With this, thank you very much for joining us for Cappuccino in Hyderabad, and have a wonderful day.
Thank you. Wonderful.
Excellent.
So this brings us to the end of this episode, and do join us for more insightful discussions on Yashoda Hospitals, the Health Talk session. Until then, take care and stay healthy. Thank you.